Welcome to Leading Safely. Let's start the show. We're judging our pool where the insights flow, sharing knowledge and experience from around the globe. It's all about learning, so let's go. Oh, yeah.
Hi everybody, welcome back to the Leading Safely podcast, and apologies for the massive gap in time since the last episode. Things have been very crazy hectic for me, speaking and doing projects and consulting now on my own. I've left my role at Coke and PhD studies, and George, my son, whom some of you may know, I'm going through diagnosis with at the moment. So lots happening. It's been frantic, and things are starting to kind of make sense and slow down a little bit. But anyway, you do not want to hear about me. You want to hear from our special guest in today's episode. So today's episode is a very awesome one. It is one of those mind-bending ones, actually. And I say that because every time that I speak to this special guest, I am always either left confused, challenged, or passionate about something in particular, and I mean that in the bestest of ways possible. I'm speaking about Professor Nektarios Karanikas. In this conversation, we're going to talk about powerful ideas about defining safety, why safety is not just an outcome but a duty, and how health, not just safety, should be at the heart of our work. We talk about his groundbreaking research with Hutchinson Builders, the real role of new safety paradigms like HOP and Safety Differently, and how to make change sustainable beyond the individual, which, as you know, is my PhD topic. So really, I think you should get ready for a thought-provoking, challenging, and very inspiring discussion that will have you questioning and potentially reframing your own approach to health and safety. Let's jump in. I'm studying change agents like myself and your safety managers in your courses. And when they initiate modern safety paradigms within their organizations, whether those safety paradigms will stay, like sustain, or flop after they leave the organization.
I think it's the second one because it's quite personalized. I don't think it's institutionalized.
Yeah, so we want to learn about, why, like what creates sustainable safety change when you're trying to drive a modern safety practice like Safety 2, resiliency, HRO.
Unless the person stays there like for 20 years.
Yeah.
And then becomes, like norm and the way we do things.
Yeah, we've seen it, right? Every time a CEO changes, like the whole culture of an organization.
Yeah, many. It's not the CEO only.
No, I know.
Yeah,
but
many like the senior leadership.
That's right.
The team.
Who drives the change and what happens? So whether it's systems
or
that have
resist,
to be...
somebody can drive, but then you have people at the line management also. I remember Sydney nicely talks about prima donnas, and I think this is in one of his book I really love that, the prima donnas. I mean, like the people that really have the power, not formally, but those mediators between senior management and workforce that can really make the difference between success and failure. I believe I have seen that in my career. I have seen that in my career. I mean, you could reach, but they could not listen to you if the prima donna could not endorse you.
No, 100%. And I've done a number of interviews already with change agents, so safety managers around the world. And so far of the interviews, the one thing that most people regret is not getting those leaders on board with their initiative. Or thinking, I am the safety manager, I can implement whatever I want to implement, and I don't need buy-in, And even I talked to someone the other day, and they said, oh, just go rogue, just do it, don't even ask for permission, just do it. You're like, I'm not sure.
Not in 2025, dear. Maybe in 1975 could work, maybe.
No. And great that you put out the study. Was that with one of the students in the course as well?
No, it's not. No. So Harun was my research associate in the project with Hutchins. While he was finishing his PhD with UQ, and now he has moved to South Australia, the regulator there. Yeah, but
Oh,
this is in
nice.
capacity as QUT research associate, not.
Yeah.
So
Oh, that's
yeah, the
great.
regulator. Yeah.
What drove you to do the study in the first place? Because I know you'd
I
been
don't know,
working with.
it's a project. I mean, the study is part of a
But
project.
you
Yeah,
could have
we
said
can
no.
discuss about that.
Why did you say
Of
yes?
the project. I know. I don't say no. If I have the time and give the money because we need the money.
That's
Yeah.
not the right answer. If they
Yeah.
have time and money, you just do. If we said, oh, well, you need to research this, you don't care
No,
about the
I
question.
can tell you
or-
the story behind. I can tell you
Yeah.
the story behind. Yeah, how this research came to be. It's very interesting. And the guys are very nice because they want to be named. It's a guys we're not disclosing any secrets here. I mean, confidential. You Hutchinson. It's
Yeah.
a big construction company.
Yeah.
They're very accommodating, great people. Of course, there are people that resist us everywhere. Nothing new. Very negative. Anyway, yeah. So we had a variety of experiences, but positive on average. Um, so the study that we published is actually the first one in a series of studies from
Oh,
this
okay.
project with Hutchinson Builders.
Yeah.
We just published another one that Bain summarized on LinkedIn. So if you would
Yes,
like
I
to
saw
have a
that.
look at the new safety paradigms.
Yeah.
So before that study, we also published a literature review about the new safety paradigms and
Yeah.
how they uh, what they advocate really. Are they about safety or something more, something wider? So anyway, when we were invited to do the project with HB, that will be the acronym for
Yes,
Hutchinson Builders,
HB. Yeah.
HB, I had at the back of my mind always, okay, we go to talk about health and safety. Do we understand the same thing? Because you might discuss about several concepts
Yeah.
and ideas, and we think we are on the same page, but we are not. And that's a catastrophe because we think we have an agreement, but we have agreed on different things. So
Yes.
that's always been like a concern of mine. I didn't have the opportunity to do some field research about that. So I have reviewed the literature about different definitions about health and safety and risk because those concepts are interconnected, although I think it's the first paper where we really connect them in one place. Now, the interesting part is that none of those publications, the ones I reviewed at least, quite many, had defined health, safety, or risk through empirical studies. They could just, Georgina say, I think this is health. And then Nektarios say, oh, I think this is safety. And then Paul and Peter and Maria, whoever is, that's risk. So we didn't really locate any research about emerging, like how do people understand? Because there's a paradox here. We say that we should consult with people, we should engage workers, all stakeholders about health and safety, workplace risks and the like, and controls and changes. So it would be interesting to see, okay, since we advocate, we preach engagement, let's engage them to define health, risk, and safety. How do they understand those things? So we did those workshops, and it was nothing revealing when it comes to the definitions the participants gave. Why? Because the variety and diversity really matched what we found in the literature.
Okay.
So we had about 50 people in different workshops, and
Yep.
all together you could really find direct correspondences between literature and what they said.
Awesome.
Different understandings.
Yep, that's great.
So that was not very surprising, although we didn't know how the definitions they have shaped in their minds came to be. We did investigate, whether
Where
they
they
read
got it
something, whether they listened to Georgina or whoever.
Yep.
Anyway, now the benefit of that was that we sat together and say, okay, guys, you see that we are talking about different things here.
Yeah.
Can we sit together and take literature into account to see what criteria we need to put up there to come with definitions that we can all agree on that reflect what really health, safety, and risk are about? That was the first task. And the second one was, how do those constructs connect with each other?
Okay.
Because the argument indeed that we make in the paper is that the concept of risk exists because health matters.
Yeah.
So if health wouldn't matter, if I got injured and could be okay, we would not discuss about risks.
Yeah.
The concept of safety exists because risks exist and we want to manage them.
Yeah.
So that was the first time that we don't have those graphs in the paper, but I have published them on LinkedIn,
Mm-hmm.
that we have this triangle or this connection between health, risk, and safety.
Yeah.
So there was a great discussion during the workshops that we defined the connections, and Hutchinson actually builders got the simplified version of those connections and have put that in the policies and have shown that to everyone, say, now we understand what safety is about. A
Okay.
very simple presentation. It's not a model,
Yeah.
it is a representation. And then we realized that, okay, if we oversimplify the definitions, could be okay for laypersons, people that do not have health and safety duties that much, or subcontractors, people that are not that much educated. So we need simplified versions of that, but on the other hand, we also need some more comprehensive versions when it comes to design, to decide, to talk about safety. That's why in our paper you have 3 different tiers. We had the simplified version targeted mainly at the operations, simple level. Then we build on that. We don't remove, we add. We have the summary version, would be nice for line management, senior management, this guy, higher. And then you have the comprehensive, which is about health and safety actually staff and technical experts that really need to consider quite a few variables, not oversimplifying safety, because those people will advise senior management or will come up with solutions, recommendations about health, safety, and risk. So that was the concept behind the paper. And of course, this has quite a few implications because the way you define then has also let's say cascade effects in how you measure what you measure,
Well,
things
that
like
was, I think that was the interesting part that I thought those definitions might drive, I guess, like what you think the implications would be, for an organization who would like to attach themselves to those definitions. Like you said,
Yes,
obviously metrics would change. I'm sure there's other things that would need to be
if
realigned,
I
right?
would start with our profession,
Oh, that's not small.
implications for our profession.
Yes.
I think we have not realized what we serve as health and safety professionals.
Okay.
Most of us talk about safety. We are safety experts. Okay, I will do some parallels here. If you go to a cardiologist
Mm-hmm.
and you say, what do you serve as a cardiologist? We say, we serve the community health.
Mm-hmm.
Now, cardiology is the discipline, the specific area, which they indirectly serve also because they have to advance, they have to feedback, about tests, about diseases, about, diagnosis, whatever. But still, what they serve is health.
Yeah.
So I think we have not really acknowledged that as health and safety professionals, we don't serve safety, we serve health.
Okay.
Safety is our vehicle, is the way through which we serve health. This does not exclude that we serve safety as a discipline, like to advance, the tools and the instruments and the theories. But our mission is not safety. Our mission is health. So this actually suggests a really shift in our thinking and the mindset. We are health professionals in a way, allied health professionals. Now, the other interesting part here is that even in some books, we separate safety from health, and we say safety is about immediate influence like injuries and fatalities, and health is about more chronic, underlying, problems, which I completely disagree. Why? An injury isn't it a health problem? I mean, where do you go when you suffer from an injury? To an engineer? Do you go to the quality department? I mean, where do you go? You go to the medical profession. I mean, why an injury is not health related? It's not health, it's non-health. But
Yes.
so I think it's not about just redefining what safety is and there isn't health just for the sake of publishing a paper there and making a nice model or 3 nice models based on the connection. But what does it mean for the profession? And indeed, just by coincidence, 2-3 years ago, we did a desktop review of the health and safety courses, university courses in Australia.
Oh, okay.
And we found that 70% of them indeed are nested under public health faculties and schools.
Oh, wow.
30% of them are nested under business and law.
Yes.
Now, this has another interesting, part. As we say in the paper, based on the definitions we gave, safety is not an objective.
Yes.
That's another problem we don't reframe.
That's been your argument for quite
It's
some
an
time,
argument. It's not
Nektarios.
an
Yes.
outcome.
No.
Safety is
Yes.
duty. And,
Yes.
and it's not a paper that says that. First of all, we have legislation that it says it's a positive duty.
Yes.
Now, somebody say why the one should exclude the other. Why? Because if somebody has a duty, somebody has a right. Now, outcomes are system outcomes or individual outcomes. There's no safety outcome. Now, there could be injuries or fatalities, but those are health outcomes, first of all, not safety outcomes,
Yes.
through the lens of safety. I will park this for the time being. Okay, now let's go put the other argument. So, if you name something as an objective, it's like optional. The objective today is this. Next year, we're going to revise our objectives.
Yes.
If we don't meet them, we're going to reflect, but we're going to find a way to improve. I disagree, Georgina. No,
Yeah.
health and safety is not an objective. It's a duty.
Yes.
It's like, I'm not sure whether any financial director has gone to the senior management leadership, whatever, CEO, and say, are we going to pay the wages this month, or should we skip it for next one? Should we pay the taxes? No, there's no question about that because that's a duty. So the same applies to health and safety. Another, I think, area we should reflect on as health and safety professionals. Now, because we want to speak the managerial language and people do not understand, that's our argument. We convert safety from duty, health and safety from a duty into an objective to speak the language. I disagree, because then you give the impression to people that's optional.
Yeah.
Okay, that's one problem. Now, do we have objectives related to health and safety? You can have. I mean, the actions, the support, the systems you have around health and safety.
Yeah.
How many audits, investigations, how good, quality, quantity, programmatically. Yes, put there your goals and objectives. Whether it comes to well-being, I agree, because well-being is like has benefits because you can promote, productivity, you can increase morale, and think. I agree. You can put well-being there to increase well-being as an objective and, vision, whatever you name it.
Yes.
But health and safety, in its core, is a duty made. Let's do not confuse what we should do and then how we can support our duty, that we exercise our duty. That's the second argument. Let me take a break and let you ask.
It's interesting because you just reminded me, I've known you for a few years now, and as you were speaking, I remember some of those very early conversations about you challenging the notion of what is safety. We talk about health and safety. What definition do you subscribe to yourself? What's your view? It is a duty, yes. If someone asked you in the street, Nektarios, what is safety to you? What would you say it is?
As we put in the paper, in the most simplified version of it, is the actions to control risks.
The actions to control
risks. Whatever actions you take. In the paper we say not the interventions. Interventions can support the actions, can give the resources, the training, to people. Interventions are a bit wider. Actions are specific. I mean, if you do investigations, to me it's an intervention. It's a process you run to support health and safety. Now, if you have actions out of those investigations or your audits to control specific risks, you do safety.
Okay, I understand. No, that's
so. I mean, not all safety management activities we do add value if they do not and conclude with minimizing exposure to risk, because this is what the legislation also wants. And the legislation, I think, reflects community standards and expectations. There is no law out there saying you should have no injuries. Okay, no law says that. Says that you need to, if you have an injury or fatality, you need to prove that you did the best you could to manage the risk. And we have plenty of cases in Australia, I guess overseas also, where the regulator charged the organization or patients about a serious injury or serious risk or a fatality, and there was no conviction because there was quite some evidence that the organization or the director, did the best they could with the resources they have and the knowledge and the opportunities to manage the risks.
They did all they could.
And this is our mission, to support organizations and individuals to build the capability to manage the risks. That's the core thing. Not safety in terms of the management processes, which are important and we should have, but if there's no connection between the service and the goal, which is to control risks, then we need to reflect what is the added value. That's mine.
That's probably a really good question for all safety professionals, right? Like if what you're doing doesn't impact, like the control of risk, what are you doing?
What are you doing? Are you promoting your your expertise because it happened like I'm a certified whatever? Good. Good on you, mate. Use this knowledge and expertise in your excellent and bright minds to help the organization control the risks. Because this is what we are here to do.
That's fair enough.
That's the simplest way you can put safety into the game. Of course, if you read the paper that we have those tiers, I mean different definitions, we talk more about, for example, safety is not actually preventing exposure to harmful hazards, but also ensuring that we're not deprived of the useful ones. So, and if you go to the psychosocial health space, for example, depriving me of the opportunity to, interact with colleagues, or to feel acknowledged. Okay, here we're talking about another risk we should control. So that's why, but we don't want to present to the layperson, a very busy, rich definition. That's why we have those extra variables and elements in this paper, in the definitions, mainly directed to strategic levels and technical expertise. Because we indeed, to align with the positive mindset, we focus justifiably, but we over focus on negatives like exposure to problems, and we don't see sometimes the risks from the absence of positives, of meeting needs of people.
No, I agree. I was just thinking about when you were talking about Hutchinson Builders changing policy already based off the things that you've learned and what you've published. If another organization reads your paper and wants to start on the journey of let's tweak the way we view safety, have you got any tips or advice on where they should start first? Obviously HB might have started with policy. Is there any other?
To be honest, because the paper is a very thorough research combining literature and perspectives from a diverse backgrounds, I don't think there is about changing the definition. It's about how do we work with the definitions. How do we adjust modify, redesign our systems
Mm-hmm.
to focus on what matters. And once more, health is what matters.
Yeah.
Safety is our tool, is our discipline, is the great field we use to serve health primarily.
Yeah.
Okay.
Yeah.
If we put this mindset, and this is what amazed Hutchinson Builders, and this is what the feedback I received from many colleagues overseas in Australia, that it's the first time that we see health placed in the frame.
Yeah, most definitely.
Yes, because
Yeah.
we forgot about the mission. We fixate on safety.
No, most definitely.
And
Even roles, like I'm thinking about role titles, that have
yeah,
been held. Like, you've seen health, safety, environment, health and safety. And then I've been in roles where the health team was a whole, like, you're
yeah,
in another building, like we don't even talk to each other. You're just a safety advisor, Georgina. Like there's no health, just
amazing.
safety.
Yeah,
Yeah. But
you cannot separate those two. As I
yeah,
said in the beginning
yeah.
of our discussion, they're interconnected. The one exists because the other matters.
No, I completely agree. I think what you've done is made something of like what most people would think is obvious, but you never hear about it, blatantly obvious, and you've linked it, right? Like it's not it it is what it is. Like the whole reason that you exist as a safety person, professional, the industry is the mitigation of risk, right? Like to control risk, to I'm not going to say prevent, but to, like reduce the amount of injuries that an
Yeah,
organization has. That's your whole purpose of being
yeah.
around, right? And
It
everything that you do should add value to increasing that.
should
But
be
yeah,
connected in a way. Maybe
yeah,
sometimes there is not
yeah,
a direct cause effect. I mean,
yes,
yes, okay, but if there is a good argument and
yes,
some evidence, yes, please go ahead, and then you will create the evidence. Sometimes
yeah, most
we
definitely.
initiate, something new, and we're not sure. It's
Yeah,
fine as long as there is good reason and argument that it will connect to minimizing harmful risks or maximizing good opportunities. The positive,
yeah, that's a
side
nice
of,
spin.
yeah, yeah. Okay, that's the two things. You need to reflect on that. And now the other implication, indeed, is that all this debate about safety performance.
Mm-hmm.
So safety, we say, since it represents the actions to control risks, is performed, does not perform. You cannot have both. Sorry, you need to pick.
Yeah,
Something is performed or performs. Okay, so our argument is based on the definitions and the discussions and literature that safety does not perform. It's not a construct that performs. Is a construct that represents what we do to
yeah,
control risk. So it's an activity. It is performed. It is performance itself. How to say that? Okay, it's not
yeah, yeah, yeah,
performing.
yes.
Now, this has implications because indeed what we call fatalities, injuries as lagging indicators are not first for safety performance. Those are health, first of all,
Yep,
problems. Okay?
yep,
Not safety problems.
yep. According to your definition, yes,
Yeah,
they would be health. Yes.
could be health problems. Second, it is monovision. It's very narrow to look at those outcomes, irrespectively of other outcomes. Because
Mm-hmm.
if you say that my injury is a health or health and safety, whatever negative outcome, you should look at the same time about quality, security, productivity, efficiency, because maybe from a systems perspective, I failed in health and safety, but I succeeded in quality.
Mm-hmm.
So although we have so much literature discussing about competing, priorities and goals,
Mm-hmm.
it's not productive to look only at those system outcomes once more and not safety outcomes, system outcomes, because the system does not do safety. System does safety and productivity and quality and security
Mm-hmm.
and promotion or whatever they do. That's one problem. And then the second one is that if we go to the leading indicators, you see that all those are about the quantity and the quality of the activities.
Yeah.
Okay. Now that's programmatic, that's managerial.
Yeah.
That does not measure safety. It measures what you do about safety, I agree, but not safety.
Yeah.
It doesn't. I mean, how many audits? Good. Yeah. You have 20,
Yeah. That's great.
scheduled. You did 18. Those are the funding. Great. So measuring the audits is indeed important. I don't say
Yeah,
about
of
them,
course. Yeah.
but realize that's about an activity.
It's not safety. You're
It's
not
not
measuring
safety.
safety.
You
Yeah.
don't. So we say there are two maybe simple ways to talk about safety metrics. We don't measure safety directly because safety is a construct you cannot measure directly, But we say that the two constructs, two metrics that we could investigate further, examine further. One is, since safety is about controlling risks, the simplest one is we call it a relative safety effectiveness, meaning how much change in the risk level you had before and after. So you had level A, and then you did safety, meaning you control the action, you had some control actions, and you have level B. So if you divide level A by level B, so the change, then you have actually the relative safety effectiveness, how effective your safety, meaning the control actions were. As simple as that. Now, of course, somebody say, how can we measure the risk level? That's a whole other story. We have thousands of papers about that. Okay.
Yes,
but you can do
have
that.
rainbows for that.
Yeah,
don't we?
quantitatively, qualitatively, doesn't matter. Okay.
Yeah.
It matters, but I mean, it's not part of our study.
Yes.
And the second one, we say, okay, we call about the relative safety level. So for us, the safety level is what is the protection you have provided? Okay. The safety is about controlling risks, meaning the protection you have provided, divided by the maximum practical protection you could have provided.
So the difference between what you actually
what
did
you
versus
do and what you could have.
Okay.
Right here, that's and which aligns
Controversial.
perfectly with the reasonably practicable concept of legislation.
Yeah,
because
does that leave
what
somebody
you do,
open?
what you have done, and what is practicably in your context.
Yeah.
Possible. So if like practically we assess we have like those options, okay, to control the risk, to protect health from harm. And we have done 90% of those for some reason, delays, resource problems, money, or whatever, we're waiting for something. But practically somebody would say, well, mate, yes, you could have done that if you had, let's say, diverted some money from another area. But you decided for the time being not. So the difference of the rate between what you have done now, and what you could have done practicably, reasonably practicable, okay, in your context, for us is the relative safety level.
Yeah, right.
And we say we cannot put that in a uniform way, deterministic way across all organizations, the industry sector, even for the same company, the same enterprise, different operations. And this is another way we should think about how well do we do safety. Those two metrics, relative safety effectiveness, before, after the change in the risk level, and relative safety level, how much protection I provide related to the maximum protection I could have provided within my context.
Yeah. You didn't touch on, I remember in the very first presentation that I had you do, you talked about the hierarchy of controls.
It is in the paper. Do you have time for that? It is in the paper.
I remember you said the hierarchy of controls is the hierarchy of options.
It is.
Yes, and that has stuck with me my entire career. I have kept it and said, Nektarios, I always say this really great Brisbane professor, he said, and I quote you and I say, he says, don't think of it as a hierarchy of controls. And I also remember you saying, if you get to PPE and you're handing somebody a helmet, it is like the company is saying, thank you very much, go protect yourself.
Yes, it is. It is. So we say in the paper about this that when it comes to this hierarchy of controls, which is in our regulations in Australia, first of all, the regulations have three options: elimination, substitution, and engineering. Okay.
Yes.
3, listed 1, 2, 3. Then there is a paragraph that if the above
Yeah.
do not work, then do
Yes.
administrative NPP. Okay, first of all, it's not something new that Nektarios and his team just out of nowhere. Now, the definitions we have actually now confirm.
Yes.
You do not disconfirm what we already have in the regulations. Why? Because if health and safety is a positive duty to control risks, good, then from an organizational perspective, the PCBU, as we say in Australia,
Yes.
what does the company do to eliminate, substitute, or engineer? This is what they do. Actions. Now,
Yes.
when they come to provide procedures and PPA, actually they don't do any action. They do an intervention.
Oh, so that's how
Okay.
you link it
So
back.
they provide the resources
Yeah.
to people
Mm-hmm.
to control the risks.
Yeah. As
Okay.
opposed to physically taking action.
Indeed. So that's it's not only conceptual difference here.
Yeah.
So it is the reality. We need to think again. And that's why the regulations say you need to do your duty, elimination, substitution, engineering. If this is not enough for many reasons, we don't say that that PP or procedures are bad, but realize that this is what you need to do. And after you feel comfortable that we have not managed the risk to the possible, as much as possible, then go to the option of providing resources, because when you impose me a procedure, you give me a document is a resource. You give me training is a resource.
Mm-hmm.
You don't control anything. You ask me to use your resources to control the risk.
Yeah.
Am I right or wrong?
No, you're right. You are, my definition of you would be a mind bender. You, every time I talk to you, I am mind blown, but not blown. Like my mind is just twisting. Like, what did he just say? Like, yeah. No,
So that's
you
why
are
I say
correct.
the hierarchy of options from the perspective of the
Yes.
organization.
Yes.
And that's why I say options to control and
Yes.
options to people to say people to fend for themselves. You're providing the resources and tell them, guys, this is what we could do. We cannot do much more for those reasons. And consultation, of course, with the workers, we need to follow those policies and procedures and put the OPPs on, which is fine. But acknowledge again, despite any limitations of human performance, compliance, behavioral, things, that when you say to people, this is as much as I could have done, you actually ask people to action to control the risk because you cannot do more. Now, it's another story if you could have done more or not. Go back to this relative safety level. The protection I provide, the maximum I could have provided my context.
What was practical?
And to reflect, yes, and to reflect. But say to Nektarios, take your, let's say earplugs or whatever to protect, because this is the way we manage the risk around. It is possible, but you just actually try to discharge your duty through asking me to do a job that whatever. So it's okay, once more, as long as we realize the difference.
Yeah. Do you think, though, then that regulators potentially, we've talked about some fines, but do you think that regulators need to review or perhaps realign the way that they're viewing the, not the interventions, the actions that organizations and that relative difference between what's practical?
I think that this is actually what is happening already, because as I said before, if you go to a trial, because the regulators can, enforce through penalizing, it's a way, you will see that the test, what you did, what you could have done.
Yeah.
This is the test.
Yeah.
This is the test. And also just to add here about the the hierarchy of controls adoption, it's already in the regulations, as I said before. Now, to connect this now with the new safety paradigms, for example. So if you see the big picture, say, okay, do those control risks? I mean, where is the role of this new safety thinking in safety? If we want to be honest and fair, yes. In what way? It's actually protecting the workers from the risks that your management system creates. It's about psychosocial risks because indeed, if you don't have a fair, balanced investigation process,
Yes.
which is in your system,
Yep.
then you create a psychosocial risk
Yeah.
for the people involved in investigation.
So they could be blamed. They could,
Yeah, it could be blamed, could
receive.
be feel what if you don't
Yeah,
have
all
a good
sorts of.
rehab,
Yep.
psychologically and
Yep.
physically rehab, okay, system, then yes. If you impose and you don't really consult, then you
Yep.
create psychosocial
I see.
risks for people involved, like
Yep.
manager, supervisor, workers. So there is a place, but we need to acknowledge the place of all these new safety thinking paradigms in the organizational attempts and endeavors to control what risks are they about. They're not about chemical risks. They're not about
No, most.
understand
Yes.
falling from height.
Yes.
They're
That's
about
right.
the
They're not physical
psychosocial
risks. Yeah.
risks. Be careful now coming from the procedures that we as health and safety professionals have designed,
Yeah.
endorsed, reviewed, and whatever. So we create the risk for workers.
Yeah.
The investigation process is
Yes.
something we contribute. We don't have full control over how an investigation will be performed, indeed, but
Yes.
we are part of the solution or the problem because
Yeah.
if the audits or the inspections are there to blame, to intimidate, to disrespect people, and we still keep it as is, then we become a problem,
Yeah.
part of
Yeah.
the hazard and the risk. So
Yeah.
this is the place now just to put things together because
Yep.
the new paper that we
Yep. No, I
also
saw that
published with
line.
the new
Yeah.
safety paradigm, this is the place where those paradigms,
Yep.
which I use and I respect, regardless the criticism sometimes I make about,
Yep.
are they about safety or about organizational management,
No.
still have a great role to
Yes.
play in the psychosocial
Psychology. Yeah.
hazard risk health space.
Yes. And I was thinking, I don't think I've seen, and maybe I have, but I don't think I've ever seen anyone claiming resiliency engineering, safety differently, new view, HRO stops people falling off roofs. Or,
Yeah.
like I don't think I've seen anyone say, if you do HOP, you will reduce your, working at heights injuries by like that they don't, to me, they don't align in that respect. It's almost
Yeah.
like process safety versus fluff, right? Like I 100% agree that it's the psychological / psychosocial space
Yes.
that
Yes.
the
The thing is
newer
that
paradigms.
we have not really, once more, acknowledged the role and the value and the connection. So
Yes.
that's the thing that we have all those excellent thinking,
Yeah.
behind,
Yeah.
and we
Definitely.
haven't linked that to where is the safety thing here. So
Yeah.
it is partially, but
Yeah.
not the whole envelope
No.
of safety.
No.
That's the
Yeah.
yeah.
Yeah, and I think that's different, right? Whereas you're talking about those interventions and those actions, they are
Yes.
directly related to, did
Yes.
you provide edge protection? Did you give them the right tools and equipment
Yeah.
to do their job, right? The
Indeed.
psychosocial and psychological safety aspects of that are a very different space and come into it at different avenues as well, right?
They have, but still you need to have controls
Oh,
in
no.
place. Okay,
No.
now, I mean, the new paradigms are the intervention side, not the
Yes,
controls themselves. So
correct.
you need to use the thinking and the principles and everything there to design and
Yes.
implement
Yes.
controls. Otherwise,
Yeah.
you don't do safety, even in the psychosocial space.
Yeah.
You just talk about
Yeah.
it, which,
Yeah, that's right.
you debate and it's nice and
Yeah.
excellent. Yeah, and then you leave the room. Okay, another day,
Yeah, see you
another week.
later.
Yeah, see you
Yeah,
later.
well, it's
So
true, right?
that's the
Yeah,
point here.
you're not designing variability or error tolerant systems, and you're not designing anything to be safe, right? Like you're still going to have failures.
You need and sustainability.
Sustainability.
Sustainability
That's,
is important. I mean, you do something. I mean, as we started the discussion, I mean,
yeah.
will it survive as long as Nektarios is there, or Nektarios changes job, resigns, retires, and then because this happened in my career. I don't want to disclose when and where.
Yeah, okay.
But it was so personalized, I regret that I didn't have the techniques, the way to make it more institutional than person focused. So, I did something, created something nice.
Yep.
Even actually my colleagues, the team there said, Nektarios, yes, you're leaving. We are sure in 6 months from now, nothing on that will exist.
Oh, that's really sad. I would think
It's
that you're
okay. It is what
unforgettable,
it is.
Nectario.
It is what it is. Well,
What what do you think makes something sustain then? You know, like if HB, if other organizations go around and start changing or trying to, you know, like change things up for health to be the focus, redefining things, what would make something sustainable then? What's
yes,
the
I
key?
think the secret here is to meet needs, not to create
Yeah,
or design needs for others. Because we have the service and the product, let's use it, guys, because we heard it's good. So this is
yeah,
what we're missing, which in the public health domain is very important. Community needs. So
yeah,
we don't really go to say what the worker needs, say what we have to give you, because this is the solution and we have the answer here.
yeah,
So it's not only going to the workers to seek answers and solutions, but what do they need? We don't really ask them, what do you need?
yeah.
We ask them,
That's true.
what do you believe about that as a
Yeah,
solution? Say, well, it sounds good, we can do that.
yeah,
But what do you really need?
yeah,
It's a question we don't frequently ask. And then if we find ways to meet those needs, I think we will secure more or less some more sustainability there. Because people
yeah,
say, it is for me, it is
yeah.
about me.
Yeah. And you're building buy-in and engagement and trust, right?
Yeah.
Those psychosocial, psychological
Yeah, but
things
you
we
can
do
build
work for.
engagement and trust even with the practice now that you ask them about solutions and ideas.
Yeah.
You can build that. But when you
Yeah.
go to what do you need,
Yeah. Right.
then it becomes more, relationship based, more, a bit deeper, all those,
Yeah. Yeah.
trust and
No, no. And
yeah.
was there anything that surprised you, Nectarios? You know, like through, you've met a lot of students who come from varying backgrounds and then doing this research with HB, seeing professionals in the wild, I guess.
Yeah.
Was there anything that popped up to you like, oh, that's a different perspective, or I wouldn't have expected that to come from, like, was there anything?
Yeah. Now this reflect on the second paper
Hmm.
uh, that we published. All these construction companies, we have this sometimes impression that construction very mature and culture and very blaming. Hutchinson Builders has a great culture when it comes to this, you know, um, let's say tendency that other companies might have to seek perfection. They understand there must be a balance, the reasonably practicable part,
Hmm.
and that absolute visions about zero zeros can be harmful. That was amazing. That was very
Oh, that's really
revealing
great.
in this second study. I was not expecting that, to be honest.
Yep.
I was expecting a bit more. No, we go for
Yep.
zero. Well, that was very nice. And also that whatever programs we have and policies and procedures which are amazing, we need to find, to create, not to find, to create opportunities for people to come together with an open agenda and
Yep.
just give opportunity to different roles and people once a year or twice a year. That was a very actually joyful experience that
Nice.
I didn't actually add much value during some workshop we had, but it was about people. I was just a catalyst in terms of what? Just
Hmm.
because we do the research with QQT, we need to come together to discuss something.
Yeah.
And then the discussion was floating around in different topics, and
Oh,
people
that's
then say,
fantastic.
how fantastic that we are
Yeah. Yeah.
together. And we discuss for the first time with no structure like
Yep.
10 to 10, it's
Yep.
Georgina
Yep.
and
Yep.
the
No
chair and
agenda. Yep. Yep.
just,
Yep.
yeah.
How
This
awesome
is
is that?
something important, especially when it comes to safety, because we are consumed by our routine and your busyness, and we need those to create the breaks, not to
Yeah.
say, guys, you need to try to create the breaks. Okay? People, your paid time, this hour we're gonna, and small teams. I don't think it's gonna work with 50 people in the room.
Yeah.
8 to 10 people, for example. Yeah, that's my takeaway five as a personal research and professional, experience from this research.
That's lovely. Oh, that's awesome. Well, I think that wraps it up. It's been awesome to
Okay.
get your perspectives and touch base regarding the new articles. They're free, aren't they? They're
They
free
are open
access. I've
access.
seen
Yeah,
both of
that's
them. Yeah,
great.
they are
Yes.
both open access and able to be downloaded as well,
Yeah,
which
I'd
is
invite
fantastic.
people, yeah, to read as carefully as they can. Usually you can go to the last part, and if you have some questions, you can go to the section above. And then you have
Okay.
further questions, you go to the section above. So because sometimes our papers are long, I don't recommend that practitioners, professionals read them top down.
Oh,
I say
really?
start from the conclusions and then go to the discussion. And then if you're concerned about
Oh,
the discussion, go to the results. If you're concerned about the results, go to the methods.
okay.
And then if you want to understand more about the context behind the background, go to the introduction.
Yeah, right. Okay.
Otherwise, it can be a bit, how to say, long. It could be
Yes.
time consuming. So this is the way you can read those papers, not my papers, every paper.
Every paper, read
Yeah,
from the bottom
yeah,
upwards.
bottom up. This is
Bottom up.
the core message in the conclusions.
That's awesome. That's a really great tangible tip, especially, like obviously I've had to read quite a number of research articles and then reading, these ones.
Well, if you do a PhD, you have to do that.
I
But
know.
you're not talking about researchers. We're talking about practitioners and
I
professionals.
need
Yes.
Ben in my top pocket actually because he's so
Yes.
brilliant at like picking out the key things and then translating it. And I loved when it popped up in my feed today, that statement around the new safety paradigms do translate to better, like psychological, whatever that line was. I was like, yes, could we just like highlight that at least? Because there's a lot on LinkedIn, on social media around the new safety paradigms don't do anything, like they're utter rubbish. They're just spin, noise, whatever you want to call it. So it was good to see some of that.
Yeah.
But
Ben has been doing a great job. I'm amazed by the speed
Oh, yeah.
that he located the studies, because I was planning to share my new study.
Yeah.
There was a problem with the affiliation actually. So if you click there, you will see there was a mistake. It's not Queensland University of Technology. It's Queensland University of Australia, which doesn't exist. There's nowhere the mistake happened. So I'm saying they
Yep.
promised to fix that in 3 to 5 business days. Say let's wait for that, and then I will share the new study. But then
He just went and did it. No,
yeah, it's
great.
amazing. Yeah.
It's awesome. But no, thank you so much for
Thank you
chatting
for
to
having
me
me again.
Well, there you have it. That wraps up my conversation with the absolutely brilliant Nektarios Karanikas. I really hope that you are walking away with some new perspectives on what we're really here to do in health and safety, and perhaps a few mind-bending reflections of your own. If you would like to dive deeper, the research papers we discussed are open access and available for you to read. And if you do, take Nektarios' advice and start from the conclusions and work your way backwards.
Thanks for joining Leading Safely as we end our show. We hope you found an insight that will help you grow. Keep exploring, keep learning from all that you do. Ask better questions, stay curious, and just be true to you.